Hello and welcome to my health channel. Today I'm going to talk about asthma, which is a respiratory disease. This video will concentrate on asthma in adults. Asthma is a long-term and common lung condition. In the United Kingdom, for example, 5.4 million people are diagnosed with asthma. It works out 1 in 10 in adults and 1 in 11 in children have this condition. Asthma is a condition that affects people of all ages. The cause of asthma is unknown. However, we know that asthma is a condition that makes breathing difficult during an asthma episode or attack. It's a condition where a sufferer finds their airways narrow or inflamed, swollen, and the sufferer may produce extra mucus. It's very difficult for someone with asthma to breathe. So I'm going to talk about the symptoms of asthma. First one is chest tightness. Some people have a tight chest when this happens. It feels like someone is using something to tie their chest, and the chest can feel very heavy. Some sufferers have what they call the whistling sound, often referred to as a wheeze sometimes, okay? And this wheeze can be audible or you may not hear it at all unless you use a stethoscope to try to listen out for the sounds. Breathlessness is sometimes called shortness of breath. For some people with shortness of breath, it can be serious, and when one can detect or be able to measure the seriousness, emergency help can be sought right away. Often when someone is struggling with breathlessness, you are struggling, okay? Your chest may feel very tight or heavy, okay? Some may have or describe it as pain. Some may have what they call a dull ache, which may make it difficult to breathe in and out, okay? Some may feel sick. When you feel this way, there is a need to go to hospital to rule out a heart attack. If you're overweight or you smoke or you have a panic attack, then you may have these symptoms as well. Please don't self-diagnose shortness of breath. Always see a doctor or go to the emergency, okay? If you clearly know it's one of your asthma symptoms, please use your inhaler and don't waste any time. It is important to add here that some people can get out of breath with exercise. If you do notice that exercise is bringing on your asthma, you need to speak to your doctor about it. If asthma is well controlled, okay, then an asthmatic can do any exercise without a problem. Make sure you have your blue inhaler with you at all times so that if you have any symptom, you can use your inhaler right away. Frequent cough that won't stop during the day or night might be ongoing, and that shows that your asthma is not controlled, so you need to get on with your inhalers, your preventer and your reliever, but I'll speak to you about it when I get to treatment. Cough at night may be continuous until the asthma is properly managed. Now I'm going to talk about the triggers of asthma. A lot of things can trigger asthma. We look at allergies to house mites that are inside the house. Animal furs can trigger off your asthma. Some have it in coats. You go to some house, you see some furs. You go to shops, so you have to be careful if it's one of your triggers. Pulling outside when the weather is up and down like a yo-yo, or the weather becomes very hot, and you need to look out for pollen or listen out to the news to know when pollen is high outside. Smoking, if you go into a house without realizing that there are smokers there, or you are sitting or talking to people who are smoking, that can trigger off your asthma. Pollution in the air is a big trigger of asthma. Okay, and cold air can trigger off your asthma. Exercise induced. Chest infections like colds and flu can trigger off the asthma. Pets like dogs and cats in the house. Okay, the smell of the hair can trigger off the asthma. Okay, and the triggers can happen even at work, school, home, anywhere really. Molds in the house can trigger off asthma. Dust, cockroaches, smell of cockroaches can trigger off an asthma in the house. Food, there are some foods that can trigger off asthma. Irritants can trigger of asthma. Exhaust smell, carbon monoxide, exhaust smell can trigger of asthma. Gas smell can trigger of asthma. Okay, consistent sneezing is a symptom of asthma. Emotions, if you are emotionally traumatized, if you have some stress, it can trigger off your asthma. Okay, food additives is a trigger, can be a trigger as well. Feathers, so you make sure that the pillow that you use in the house doesn't have feathers in it. Chairs, anything with feathers can trigger off an asthma. Avoid asthma triggers. It's very important that you know what your triggers are and avoid them, because that's one way of preventing having an asthma attack. Okay. Then diagnosis. If you're already having symptoms and you've not been diagnosed, then there may be some tests that the doctors will have to do to be able to diagnose you. Okay, depending on where you live in the world. Okay, I can only speak about United Kingdom because in the course of my work, this is how it is done. Okay, now if you speak to your doctor about your symptoms, then the doctor would have to do some tests to diagnose you and monitor you. So the first thing the doctor would do is to take a peak flow. Now, I think the first thing the doctor will need to do is to note your symptoms and ask you questions to establish a medical history. And then the doctor will perform tests below to diagnose and monitor asthma. So one of the tests that is done is the peak flow. So this is a lung function test to measure how fast you breathe out. The reading can be recorded on a peak flow diary on a daily basis to monitor scores or readings and symptoms. Okay, the second test that will definitely confirm if the person has asthma is the spirometry test. This is a lung function test and is simply used to compare how the airways are before and after using a reliever inhaler. The reliever inhaler is the blue inhaler, as you can see on the screen. This test is used to diagnose asthma. This test shows if your airways is narrowed or restricted. We know inflammation, which is swell, can cause obstruction of the airways. In hospitals, in the past, they used to have what they call the bronchial challenge tests. I've not seen it in my days. I'm not sure if they're still doing it, but it's not recommended for children under 5. I have to say that I've not seen it in a long while. So, and it's not used in GP surgeries in England at all, because I'm an asthma nurse and I do diagnose asthma. So, treatment for asthma can be a serious condition, but this varies from person to person. It is important to avoid triggers. For most people, asthma can be managed well by using the preventer, which is the brown inhaler. Every day, 2 puffs in the morning, 2 puffs at night. Okay, there are other inhalers that you can use the same way: beclometasone, seretide, Sidropa, and many other combined inhalers like Foster as well. Okay, and with the relievers, which is the blue inhaler, it's good to use it if you have a flare-up, like Ventolin inhaler, salbutamol, salbumol. They're all the reliever inhalers. For someone with severe asthma, okay, they may find symptoms most of the time and find them hard to control. There's always a risk of an asthma attack, and it can be life-threatening. So my people, if you notice any signs that it's getting worse, continue using your medicines as advised and seek GP help or assistance. You must know the signs of an attack and what to do. If your blue inhaler is not helping you, you need to use it more than every 4 hours. Okay, some people can have 1 or 2 or all of the symptoms. You will know when you have become worse. This can happen suddenly or even build up over days or hours. Seek medical help when it has become worse. Asthma attack is a real emergency. You need to get early intervention fast. Once you feel it has gotten worse and the inhalers aren't working anymore, please go and see your doctor. Okay, if it's an emergency and you're short of breath and it's really, really bad, please call 999. Depending on what part of the world you live in. Okay, if you live in a country where you don't have a 999, try and get somebody to take you straight to the hospital. Okay, it's very important. Okay, asthma can be controlled and kept under control. Okay, there must be a treatment plan, and don't ignore symptoms if they are getting worse. There's no cure for asthma, but there are tested asthma medicines to prevent symptoms. People can get on with their lives if they can stick to their prescribed drugs. Everyone can live with their lung disease by looking after yourselves and everyone around you. Okay, so please look after yourselves. It's very important. Okay, thank you for watching. Share to friends and family. Subscribe to my page, like and comment. Thank you so much.